Friends, welcome to my channel Neurology Videos Learn by Seeing. In this video we will learn how to write prescription in a patient of stroke. Stroke is very common in neurology OPD. What are the various things we should cover while writing the prescription in a patient of stroke? We will learn in this video. So in this portion we will write all the risk factors. For example, in this patient I have written that this is a 70-year-old male who is diabetic, hypertensive, smoker with a past history of stroke or MI. So this portion you will write the risk factors. Then you will write a small history. Then you will write the deficit. For example, this patient has left hemiparesis with left 7 supranuclear palsy. After writing the deficit, you will write what territory it is affecting. That is, this is a right MCA territory stroke. Okay. After writing the territory, you will write the etiology. Etiology you will be able to make out after you get the imaging. For example, after you write the territory, you will advise NCCT head, which will tell you about whether it is an ischemic stroke or hemorrhagic stroke. After getting the etiology, if it is a ischemic stroke, you will have to make out whether it is an atherosclerotic or embolic stroke. If it is an embolic stroke, you will have to advise investigations according to it. What is the cause of embolism, whether the embolism it is coming from the heart or whether it is coming from the vessel. And if it is an atherosclerotic stroke, whether it is a cortical branches these are affected, or it is a small vessel stroke, but that is it is a lacunar stroke. So the investigations are advised according to it. So when you are writing the prescription, your prescription should tell whether it is an ischemic stroke, it is affecting the cortical branches or the lenticulostriate branches, lenticulostriate branching, lacunar stroke, which lacunar stroke, pure sensory, pure motor, ataxic hemiparesis. Okay, so the diagnosis should be complete in the prescription itself. And what are the various investigations you should advise in a patient of stroke? The minimum investigation, it is a NCCT head. But because NCCT head, it is very important because it is the easily available investigation. Okay, NCCT head, and if possible MRI brain. CV Doppler, it is very important because you have to visualize the vessels, extracranial vessels, to see whether there is any atherosclerotic process in the extracranial vessels. But remember, CV Doppler, it will tell you about the atherosclerotic process in only the extracranial vessels. It is a CT angio brain and neck which will tell you about the atherosclerotic process in the intracranial vessels. So CV Doppler and CT angio brain and neck, it will complete the package for the screening of the atherosclerotic process of both the intracranial and the extracranial vessels. For working up of embolic stroke, you have to get the ECG. Then ECG can miss, single ECG can miss the atrial fibrillation. You have to go for the Holter. You have to go for echo, and sometime you have to go for the transesophageal echo also to see for small vegetations or small vegetations which can lead to the small emboli. Okay, so in your prescription of a stroke, it should be clear which territory is affected, what is the etiology, and what are the various investigations, and last your treatment. Your treatment should depend upon the etiology. Okay, thank you.
Hello friends, welcome to my channel Neurology Videos Learn by Seeing. If you are tuning to this channel first time, subscribe it to get the maximum neurology videos, and do press that bell button to get the notification of each and every video.